Working.
Hasn't shown up on my end yet, but I'm still watching.
Okay, I think it's this setting.
There we go. We're live.
All right, thank you, Katie. Hello, everyone. Welcome to the Novi Public Library's Mental Health Series. If you've watched the past two, we've had some very engaging conversations, and we're hoping to do the same once again this evening. I'm so glad you can be with us. I appreciate you taking out time to hear what we have to say and joining in the participation in the conversation with us. Once again, we have joining me this evening Dr. Crystal Jackson, who is our series guest, our professional guest. She is a licensed psychologist. And we are going to be talking about mental health, supporting frontline workers and educators. In addition, we have special guests this evening that will specifically talk about this segment, and it's Mrs. Selena Schmidt. She is the Vice President of Behavioral Health for Ascensions Hospital. We also have Mrs. Leah Gowell. She is an educator in the Farmington Hills School District. She's a resident of Novi. And Mr. Damian Perry, he's a principal in the Detroit Public Schools at Mumford High School. So I appreciate having everyone here and looking forward to our conversation to see what we can do to support people who are dealing with all of this that we're dealing with. We're going to start with Dr. Jackson. She's the professional who can take the lead on what we're going to talk about this evening. Thank you so much for being here, Dr. Jackson.
Thank you, Gail. Thank you so much for having me. Thank you for the other professionals who are joining us tonight. I think it's so awesome, and I am honored to be on this panel with you all. And I really appreciate you all taking out time from your busy schedules as medical professionals, as well as educators, during this time to really talk about this important issue of mental health in regards to your particular and specific professions. You all are on the front lines every day, whether you are coming in physical contact in the medical profession, or whether or not you are also in a position of guiding the students that you and teachers and counselors and other administrators within the school system that are coming to you with their concerns with this online schooling process, or even in person. I know that Leah, you are in a private school setting, so I would love to hear how maybe your experience may be different from that of Mr. Perry, who's the principal in a public school setting. So I'm not sure if there's a difference with the in-person versus remote learning setting. I would imagine that there may be. So I would be really interested in starting there, because I know that our students have had to make such a huge and significant dramatic transition this school year.
Sure.
And
absolutely.
also in just 1 second, I forgot to mention, I don't think I said it once we were live on Facebook. If you do have a question or comment along the way, please type it in the comment section. We do have Katie, my coworker, who's monitoring both the chat section on Zoom and the comment section on Facebook. So we will follow along for questions. I'm sorry about that, Leah.
It's okay. I just want to make a correction. I don't work for the Farmington Public School District. I work for a Hill Day School, which
You
is
told
in
me that.
Farmington
I'm
Hills,
sorry.
Michigan. That's okay. Farmington's like, what? Yes. So we have been in person. We are very lucky that we have been in person. We were, of course, remote from March 13th last year through the end of the year. And then we began in the beginning of September in person. So I teach at Hill Day School. We have a preschool program all the way through the 8th grade. I teach in the 7th and 8th grade communities upstairs. What we ended up doing is we divided up by community. So we spread out through the whole school. So the lunchroom was taken over by a classroom. The auditorium was taken over by a classroom. Spaces that used to really make our school special and unique, like our maker space, is now a classroom. So we spread the kids all the way out, and then we divided it up. So for instance, when I go into the 7th and 8th grade community, I don't come in I come through a separate door. I don't come in contact with anybody but 7th and 8th graders. So as a result, we have had to go remote several times throughout the time we've been at school, but only so that, the 5-6 community would be down, or the 7-8 community would be down. So that has allowed us to be able to be in school. when we went remote last year, it's hard to say in terms of mental health for the kids is, at first, I mean, the kids literally thought they were going to die or something might happen tomorrow. They didn't know what to expect. Learning was the last thing on their minds. And then it became sort of, kitschy and unique. And then, we went through sort of that whole cycle. One of the things that I noticed in particular last year is students, I don't think that this comes out of nowhere. I think it probably triggers something that's there before, but there's students who didn't seem to struggle or we didn't notice necessarily as having, anxiety or depression. And that was really amplified by being remote. For a lot of kids, their home life might not be a place where they flourish. For a lot of children, there was a lot of anxiety over even technology, right? So they didn't know how the technology might not work. There are kids who I believe already, especially I teach middle school, there's a large element of anxiety in children these days. And suddenly they can't control everything, right? And there's nothing that you can do. And I'm not there to fix it. There are children who need directions sort of said auditorily to them, or they feel more comfortable when you're standing by them. And as a teacher in person, you're always adjusting and you can read the person's face. I'm also in a unique situation as my classes are very small. I might have 15, 16, or 18 kids. When I was in public school, I had, 30, 35 students. But even with 15 students online, I can't tell whether or not, how they're feeling or what their body expression looks like and whether or not they need that little bit of extra help. So that made it really difficult. And we had some students who really sort of fell off of the radar. They became, they were despondent, they didn't respond back, or even kids who remotely, their personalities didn't come through. So the kids who really struggle with learning, but they could be sort of the class clown or they hold different roles in class. And maybe that year, sort of the skills are not what's going to shine through for that kid. They're in sort of a different spot. And so I think as teachers and as educators, we're not just teaching them skills. We're not just teaching them content. We're teaching them how to be sort of, humans, how to be citizens within our world. So they're all learning different lessons. Those lessons are harder to teach when you're muting and, when you have mom watching from behind. So what I have, I'm privileged and I realize that and so grateful for this year is that even though our school is different, we can't do the group work we used to do. The kids are sitting for long periods of time. They have masks on all day long. They're so grateful to be there. And it makes it easier, I think, to teach those other lessons, those lessons that are not, necessarily what's the meter in a Shakespeare sonnet or how to write a claim evidence reasoning paragraph. But, how do you deal with conflict resolution or what do you do when you're really frustrated and you don't know how to start a problem? We have, so that makes it, it makes it much easier in person to teach those other lessons. And I really felt that online, those were some of the things that were missing because you can't, or it's too public. I could quietly, if Damien was my student and he was having an issue, I could quietly go by him. We can have like a little moment where we talk about frustration or anger or what's going on. And, within 30 seconds, no one else knows what's happened, but there's been that interaction. But if you're on Zoom, you can't do that. So to me in person, that is the most meaningful part that's missing when you're online. But I do just want to say how grateful I am. When I first started teaching, I did teach in the Bloomfield Hills School District in the late 90s and early 2000s before my children were born. We wouldn't have had school. There would have been nothing, So it's so nice that even remotely that there is that something, which I am so grateful for technology because, that just didn't exist before.
Wow, Leah, what you just mentioned about teachers being more than just content educators, right? And the really the life skills and social skills that come along with the role of being a teacher. Mr. Perry, what is your experience been like? How have you, in your role and position and leadership within the Detroit community school system, how have you been able to navigate and assist not only students, but the other administrators, the staff, and the schools that you work in?
So one of the things that we've had to do specifically, just as a leader, is really be a servant of all and really take out the definition of what a standard principle is and really expand that to really being able to address all students, teachers, parents, partners, needs. And that just doesn't mean, math, science, English, and social studies, but really having those conversations about what do you need before we actually reach that level of instruction, to be able to ensure that you have everything that you need to be successful. So in the vein of students, that is meant that through the leadership of our phenomenal superintendent, Dr. Nikolai Vitti, we've actually provided meals for our families. That means for our students that we've actually provided technology to our families. That means that we have social emotional support that's available to our families and our students as well. That's the same thing for the teachers, because one of the things that we have had to remind ourselves in the vein of testing, which has to continue, in the vein of classroom observations that has to continue, that our teachers are dealing with life, that our teachers are dealing with situations to where their spouses have COVID, they're taking care of parents that have COVID. So being able to sort of process, yes, the education of children must continue, but also we have to be able to be good stewards and good caretakers of our teachers. The same thing has gone for parents. Being able to give to teachers the insight that we need an added level of empathy. We've had conversations, you can't say very specifically that assignment is due at 3:00. We have to be able to have a level of empathy to be able to say, you know what, I probably need to open up assignments being due until 12 midnight, or I need to be able to give another week extension on assignments because there are technology issues. I was joking with Mrs. Anderson as I was dialing in that I couldn't figure out my password. I'm bumbling and trying to put in my password, but our parents are not only dealing with that, but they're also, working and also having to monitor students and do the whole 9 yards. So really the definition of a principal, the definition of an educator in the time of COVID has truly expanded. We've always within our phenomenal school district, tried to address all levels of our students and families and partners, but now we've had to do it in a way that is unprecedented within our history, that's unprecedented within our country, and really ensuring that we're doing all of those components and really adding a level of empathy, a level of understanding, and really undergirding everything with the idea and understanding that we're all working through this together, and it won't be a seamless sort of program or kind of one-stop fix, but we're addressing all levels to be able to get where kids need to be through addressing all of those specific areas.
And it's great that you have the superintendent of the Detroit Public Schools working with the teachers and students, trying to see what's, I don't even know if you call it best, but something that comforts a little bit of everyone. They're doing the same thing in Novi with Superintendent Matthews and the school board. They're constantly having meetings, trying to see what works for the teachers, the students. And I think all districts are doing their own thing at times. Sometimes they all have to make separate decisions. So I can imagine the added pressures for that. Dr. Crystal, I'm sorry.
No, that's okay. I think that you adding on, Gail, what Mr. Perry was just saying is that there's a concept in our field of psychology. It's called Maslow's hierarchy of needs. And it really does appear to me that one of the key issues related to mental health that at least educators are diving into right now is this physiological need, right? So the like really basic needs, right, of an individual, and then the safety needs, right? So we're talking about them addressing these areas of making sure the children have food, making sure that they are dealing and addressing their fears and their concerns. It is exactly what Mr. Perry said. It has expanded the area that is discussed, that is covered, that they are now really voluntarily taking on responsibility for, right? And just a completely different way than they have ever had to do before. Yes, schools, when they are open, they are providing this hot lunch program. But when you have schools that are closed, and yet the administrators are still getting extremely creative.
School buildings are closed. I just mean to interrupt you. School buildings are closed. Schools are not closed.
That's such a good point. Exactly. That's my point. The school buildings are closed and the educators and the administrators are having to get extremely creative with how they move and go about still providing not just the ordinary level of assistance, but this greater level of assistance, not just, again, going back to what Leah said, not just the educational realm, but all these other areas of life, right? And helping them to not just survive this time of the pandemic, but to still continue to thrive, which is just a completely different level of energy, creativity, empathy that's been mentioned already, and care, genuine care for who they are serving. As Mr. Perry said, it's interesting because we're talking about this issue of safety, what I mentioned, Maslow's hierarchy of needs, this issue of safety and physiological needs. Selena, if you wouldn't mind kind of jumping in here with us and telling us about nurses and medical staff. And
one thing that I would say about our teachers is that our teachers play a fundamental role in the mental well-being of the children. Because sometimes the home life is not ideal and the school is their reprieve. And so what we have seen during this pandemic is an increase in children coming into the emergency room for anxiety, sleeping disorders, not eating, self-injury where they're scratching or picking or pulling out their hair because they don't know how to express it. And now they're in a dysfunctional home where school was like a vacation to them. It is where they got to be a normal child and they weren't fearful of speaking too loud or spilling juice on the floor. And so I think that, we have to remember our teachers actually play such a pivotal role in the development of our children. And this pandemic has shaken a lot of kids. But what we have seen is, the pandemic in the spring, it was very different than this one. It hit us fast and it hit us hard. And just, like healthcare workers and EMS drivers and police, we had to turn on a dime and how we had to manage it. We did not know what was going to hit us. We didn't know if we were going to walk into 20 patients or 100 patients. And, supplies were running out because you remember most of our supplies were coming out of San Juan. Well, what happened to San Juan a year and a half ago? All of our sterile saline, a lot of our gloves, all of that came out of there and they never rebuilt. So we were preparing for the stockage, but we weren't fully prepared when it hit us. And so we all began in the healthcare industry struggling to get saline, getting, the medication that we needed. We were running out of IV, COVID is it's a painful disease or virus. It is extremely painful. And so we're giving high doses of pain medication, but the staff, they began to function. They never knew when they were coming in. They were pulled all over the hospital where needs went. They would go home today with a, understanding that their unit was not COVID, and they'd come in tomorrow and their unit was COVID with 20 patients. We were literally changing things on a dime where we'd say, okay, this is how you're going to manage this COVID patient. And by the end of the day, that changed because the CDC came out with something different. So they'd come into work tomorrow and we'd go, hey, scrap that. We got something new for you. So there was no known. When all of us came into the medical field, most of us had a calling or we had a situation in our life that brought us to this. And what we have found in COVID is that we have no control. We have no organization. We have no standard operating procedures anymore. We have lost the ability to have compassion because we can't sit with the patients for a long time. We are meant to speak, we're meant to care, we're humans, we need human contact, and we didn't have any of that. And we saw the staff starting to crumble. And they didn't even know that they were experiencing PTSD. You know, we would speak to them and you know, I'd say, oh, so how are you doing today? And she would bust out crying, I have to stop for toilet paper. I have no toilet paper. I've been working 17, and it's like, hold on, let me get our environmental care and I will get you 12 rolls of toilet paper to go home to. And so, you know, we started seeing, you know, little things like that. You know, call-ins started to occur, and, you know, you started hearing the discussion of, I just have dread coming in this morning, or the highlight of my day is that I only had to call for 24 body bags instead of 3 today.
Mm.
And so, you know, you had nurses that had maybe experienced a death a month that were experiencing a death an hour. And so, you know, they were really struggling. And so as a healthcare system, you know, Ascension is large. We're across multiple states in the nation. And in Michigan alone, we have 17 hospitals. And so, you know, we're like, okay, we got this. And, you know, we did webinars and we were doing all of this online and we were doing prayers and, you know, dial a prayer and all that. And, you know, I would start walking through the units and the associates are like, yeah, that's really great if you got time to read your emails. But they also felt abandoned by leadership. You know, they were on the front line and they were caring for patients, and we didn't have PPE. I mean, there were days that nurses were wearing garbage bags. You know, they were wearing masks for 5 days and we're supposed to wear them, one per patient. You know, gloves, they were, you know, it was just like being in a war zone. And, you know, the associates were like, you know, every day we get a new directive, but where's our leaders? They're at home sitting there behind a desk. And so they felt really abandoned and they felt resentful and they felt like they were out to slaughter. So as, you know, I started walking around and I started getting these phone calls. They're like, I can't do it anymore. I'm going to resign. And, you know, as I started listening and started making my rounds to all my hospitals, we found a lot of common things. And what we realized is that our associates, whether they understood or not, were experiencing PTSD. They had moral distress. They were making decisions that nobody should ever have to make. We should never have to look at a patient and know that I can't go in there and hold their hand. They're going to die alone in that room because we were given directives. We were not allowed in those rooms unless we had to do a procedure. And if the patient was end, you know, you can't do mouth to mouth. So we decided that we needed to take a different approach to our associates. I mean, we were giving them sitter money. We put them in hotels so they were away from their families and paid for the hotels. We opened our cafeterias into mini stores where they could go down and buy toilet paper and bread and milk without having to go to a grocery store. Because what we found is that when we wore our scrubs into the grocery store, we had those, oh, you're one of those, you know, you're, you know, that healthcare that is getting us shut down. It's because you're complaining and all that. And people just were afraid to go. So, you know, we did that. We gave them all scrubs. We gave them meals at work. Like, I don't think for 3.5 months, I never brought a meal to work. And so it wasn't what they were looking for because it was mentally they were breaking. It wasn't all the other pieces because as we spoke to them, they were like, yeah, I you know, I'm a shower crier, or I cry on my way home, you know, but I can't talk to anybody and I can't hug anybody. It was the mental piece that we lacked as a healthcare system. And so what we decided to do is that we needed to take the services to where the employee was working. We need to make it very easy for them. They didn't have to seek it out. You know, it's great. We had EAP, you got 10 free counseling visits. But you physically have to pick up the phone, get a hold of an EPA, make a schedule, make the time to go to them. Nobody had that time. They were working, you know, 12, 14 hours a day, 4 or 5 days a week because their peers were going out sick. And so, you know, they had a duty. And what we had to do is, you know, meet with them and let them speak freely. And so what we did is we brought the services to them. We had great big green badges called We Care, and they were social workers, psychologists, mental health nurses, and we actually had a wellness cart. We had, you know, like a Keurig coffee machine on the cart, and we would go in and just talk to people. And, you know, we actually brought the counseling to them, and we got them just to speak. There were no agenda, no notes, no communication back unless we found a general theme on a unit that was, really struggling. We'd say, hey, look at, we heard this multiple times. But the staff began to trust us and they began to open up on what they needed. And what we became was a walking EAP. We brought counselors in from outside. And so for those that needed something really formal, we would do a warm handoff to a counselor that would actually physically get them into one of our outpatient clinics. Our health system paid for everything. They, didn't charge the employee for any of it. But what we found is we got two moms that were in an abusive relationship, and to go because their husband now is not working and is at home, the abuse was beginning to get worse because she was going to work and she couldn't take care of the kids and she was on a COVID unit. And so we were able to help them, assist them to get out. We moved them into a hotel. We found a lot of substance abuse, which we kind of expected. But, after the nurse would go, I'm going home and having my liquid drink. And one of their peers would actually call and say, I'm really concerned. She is the most organized. And in the morning, she's the most disheveled. And, she's really not getting going until like noon. And so we would kind of pop in and out and get to know them. And what we found is that the associates began to talk freely. They told us about the good things about COVID, that we are a team, that we lost titles. Everybody was here for one reason, and that's to get the patient better. Everybody chipped in and helped. And I got to meet people that I never knew. We got things like, do not send me another email. I will never read it. And so what we did is we put together 5-minute video clips that we then would run during shift change really quick. These are the updates today. And so, we were able to pull some good things out of it. We, got flexible with our training and our new initiatives. We had to figure out is how do we get the employees to be able to release the grief? Because remember, in the first time, we had no visitors. The second time around, we decided is that we couldn't put that burden on our associates anymore. We couldn't have them be the caregiver and also be the final person before the patient passed, and then have to explain it to the family that their loved one passed away, and then have to provide grief counseling to the family members. So this time our health system decided to allow somebody to come in because we heard our associates loud and clear. They couldn't do it again. And so we did. Yeah.
Selena, I just want to jump in because you've mentioned several times PTSD, and I just want to, I think it may be worthy for our listeners to understand what exactly that is as we continue the conversation tonight, because it's real. It's a real thing, right? It's a real mental health condition that many people suffer from. And so I think it's important that we maybe kind of take a moment and just kind of look at what some of the symptoms are so people are aware and more knowledgeable about what to look out for, and what would be some symptoms that would lead them to seeking additional assistance or help, mental health services, or at least even an evaluation just to determine exactly what they are maybe challenged with during this time. So some of the things that people may recognize, one of the first things you mentioned, Selena, is that they started to call in, right? So one of the main symptoms here is dealing with avoidance, right? So avoidance of the thing, of the trauma that they're being exposed to. So I think that's one symptom. Now, the trauma or the exposure or avoidance of what? So it's a situation where a person can be in and they are looking at a threat or actual events or situations where their life is at risk, or they're being a witness to someone else's life being at risk, right? Whether it's witnessing it, or it's perceived, or it's actual. So that situation is one of the criteria that we look for as mental health professionals, right? So what was the trauma? What were they exposed to? And this could be a life-threatening situation. This could be sexual. This could be violence, right? Wherever you are in a situation like that, that meets the very first criteria of really defining what a trauma or traumatic event is. And then in response to that traumatic event, that's when you may start to have avoidance, right? Trying to avoid the situation that has created the trauma, whether it's ongoing or whether it's something that has already happened. But in this case, we're dealing with the pandemic. So to know that people have or were or maybe still are calling off because they want to avoid the trauma of seeing someone's life deteriorate in front of their faces, makes complete sense. And another area that I think was mentioned, even when it comes to teachers and students and medical professionals alike, is this change in mood. So what type of change in mood? So maybe increased irritation, agitation, irritability. Sometimes it can be hostility. Sometimes it can be severe depression. So any type of change in mood. So feelings of loneliness, feelings of guilt. Sometimes you can have increased compassion fatigue, right? During this time where you want so bad to help and you see how your students are struggling, or you see how bad the teachers are struggling as a school administrator, or you see how bad or difficult or how challenging it is for the medical professionals that work for you. And you can develop compassion fatigue and then start to develop symptoms of guilt, right? Hypervigilance, right? So hypervigilance could, be that the smallest, right, of encounters or situations that are not perfect can become extremely overwhelming. Extremely, I think you gave an example, Selena, when you talked about, toilet paper, right? And just kind of having a meltdown about that. But I think what's important for people in your position and others in leadership is to understand it's really not about that one thing that you asked about in that moment and you saw the reaction of the staff. It's really the combination of stressors that have been piling on over time.
And that was one of the biggest things that drew us, that really highlighted, is that the change in personalities of the associates is that, some became very stoic and they just function as a robot. Some actually had notepads and they would actually be marking down how many times they changed the breathing tube, how many times they did this, because they became that hyper vigilant because they were scared that they missed something. Were they the reason somebody died? What did I do wrong? What did I not catch? Should I have done something quicker? And they started second guessing themselves. And then they became very almost like an OCD about their work per function. And then they would get upset because they were slowing down and they had so many tasks. And so, we actually started watching their personalities change in front of us.
So really, it's that obsessive part. You mentioned OCD, but it's the obsessive,
yes.
Right? Obsessive compulsive disorder, but it's really, you're talking about the obsessive part, because the obsessive part is the thoughts. Right? That's the thinking. So that writing down and making sure, like double checking, it's the behavior, right? The compulsive part is the more behavioral aspect, right? So it's like redoing because because it brings comfort to maybe do something 7 times over. But having that pressure, having those thoughts, that hypervigilance part is the obsessive part, making sure that everything is done and they're documenting all those different things that they feel like that are important and truly are important. But again, it's out of this obsessiveness, right? So it's maybe doing something that's above and beyond what is really needed, but they're doing it to compensate for this feeling of worry and anxiety. Right. And they're
trying to meet these additional expectations is also pressure for many of the frontline workers and educators. We do have a question, and I'm going to put on my glasses to read. It's from someone who says, any suggestions on how to manage stress when the school leaders expect teachers to carry on as normal when social distancing isn't possible in the classrooms, rooms aren't cleaned thoroughly, and created a constant stress for us to continue our jobs? So that sounds like, some real pressures coming from higher up. Can we address that, Dr. Jackson?
Well, you know what? I think that would be a great way to bring in Damien and Leah in their positions, and particularly Damien, just because of his leadership, his role as principal, and one of the largest school district, right, in our state. So Damien, how do you address teachers? How do you validate? I think that's maybe a good place. That's where I would go. How do you validate and empathize and still meet what they're asking? Meet the need that's up underneath the complaint, right? Every complaint that a human has is out of a need that's not being met.
I would say listen. So one of the things to be able to, as a school leader, be able to listen. And I would just suggest to the person that placed that in that chat, have that direct conversation with your school leader. You know, at the end of the day, I am here to support kids. At the end of the day, I'm here to make sure that kids get what they need, but I need to ensure that I get what I need. And one of the things that is, you know, for, you know, of course, leadership to be cognizant of, you know, classroom numbers, you know, as well as, you know, working with the custodial staff, environmental staff to ensure that rooms are clean. So that I would definitely say having that direct conversation. I know as a school principal, that's one of the things that I've just strived to make sure that my teachers, first of all, we use the word family a lot at Mumford. So I would probably say, if I was at school, for family members to understand that there's an open door policy and that you can have that direct conversation with me, to be able to sort of, you know, feel as if there's not going to be any repercussions for you having that. But I would just challenge that teacher to be able to have that direct conversation with their school leader, as well as ask the school leader to maybe come down and check out the conditions in the classroom so they can see it for themselves.
I appreciate that response. I love the idea of open communication. I advocate for that. It's so important to have any positive, effective relationship. It does not matter what the relationship type is. Communication is always crucial. Mm-hmm. So I also appreciate the question that was asked, and maybe this is the psychologist in me as well. I would like to know if that listener and the person who posed the question can let us know while we are live if that response was helpful, if they have already tried that, and if maybe we can offer additional suggestions or advice. So I just want to put that out there. The person hopefully is still listening, and based on what I just posed, they will respond and let us know if that was helpful, if they feel like they need to try that, or if they, you know, have actually tried it and feel like, well, I did that already. Now what, right? This was the response I received. And even though I know that each school district is different because we don't know what school system the person is, you know, asking that question from, and we don't need to know that information, but I think that it is important that when people are asking questions, I like to know that they were able to get something out of it, right? That they were actually able to utilize it and kind of put it into action. So thank you, Damien, for that wonderful suggestion, because communication would always be my first point as well. Leah?
Also, tangentially off of that, I'm not directly addressing this because I don't want this person to think that I'm shutting him, her, them down. The one thing that I found is that, you know, it is also easy for everybody to need or want a scapegoat, right? Because we feel so out of control and we're looking for something. So I know even, you know, being in school and going into a classroom and it wasn't clean and just getting, you know, furious, and you're automatically thinking leadership, or you're thinking the cleaners. And I'm not trying to have rose-colored glasses, but the truth of the matter is, and I do believe this in most places, everyone is literally trying the best that they can, and they're constantly hitting roadblocks, like again and again and again. You know, we've even had, you know, our head of schools upstairs with the, you know, with the spray, or, you know, running down and, you know, changing the paper towel. Everyone is trying, and I'm sure it's the same thing in Mr. Perry's school, the best that they can within the parameters that they have, but it's a dynamic situation. So there's constantly something changing for me, because I know I was really angry too. I was angry at leadership. Then it causes other stress between teachers because we have it where the kids stay and the teachers move from room to room. So then a teacher might not clean because their class went over and you're angry. You know, you're just looking somewhere to put that anger, and you just can't carry it. Like, and at the end of the day, I don't think anyone went to school saying, you know, I'm really gonna make sure that like we don't clean today, or, you know, we make sure that the lunches aren't there on time, or, you know, make sure that I don't do this, that, and the other thing. But the problem is we're all, you know, you're in this sort of crucible and you're working underneath this stress that keeps compounding. So we're just looking for somewhere to put it. To me, I remember like I sent probably a nasty email to one of our administrators, and then it was the administrators that, you know, we're between cleaning companies and these people are supposed to come, they didn't come, and all of a sudden I'm looking from his point of view and thinking like, oh, you know, I didn't realize that. So I think the communication too is both ways. It's knowing everybody is dealing with this almost ridiculous situation, and I don't think we're trying to make it normal or trying to, you know, run, but you just have to constantly pivot. And, you know, you spoke of empathy, and just, I think we all just have to come from a place of grace and just, you know, you're doing the best you can. And at the end of the day, if there's somebody who's not, you can't carry that. Like you can't, we're not going to get through it if you do that. You can't do that. I know
Well, you're right.
it's probably more difficult. You know, I can't even imagine.
I think we all need to remember that these are not normal times. And
Yeah.
that in the perfect situation, it would be very different. And I know that, you know, working in a hospital, we clean all the time, but just like everybody else, they're short-staffed.
Right.
And the unexpected happens, or all of a sudden something changes and it flips us completely upside down. So we have these well-guided intentions that begin during the day, and by midday, we've thrown them out the window, we've moved on. And so I think that we have to dig in ourselves, is we have to step back and understand that just how out of control I feel, so does everybody else at this time.
Well, and Selena, you said you used the word step back. My thought was, I think one of the things that I would like to kind of offer to those who are listening is communication is always important. Can't emphasize that enough. Along with communication, I would say when you communicate, if you don't do this already, especially now, because it really does take a village, it really does take all of us working together. So even though I always advocate for communication, I think along with that is stepping into this idea of communicating with ideas, communicate with resolution, right? Communicate and brainstorm, right? So this is what happened. I didn't like this, or this is what happened. I've noticed this pattern since the start of the school year, or I've noticed this pattern in the hospital or in this medical facility for this length of time. I've been watching and observing, and this is not okay with me. Here are some suggestions, right? So with that, however, with those suggestions, and I feel like Gail, I may have said this before, with suggestions come patience for implementation.
Yep.
And
You said that, yeah. Why didn't you call my name? You addressed that to me the last time. I'm working on it. Yes, you did.
So with suggestions, it comes patience. Patience comes along with that. And it also, what also comes along with that is understanding that maybe your suggestions won't be implemented maybe at all, or not right away, right? Maybe there's like some version of what you suggested that ends up being implemented, right? Because you have to understand that those people who are at the top and they're responsible, they're looking at things from a much larger view and perspective. And so they have to consider not just your request, but they also have to consider everybody else and how your request or meeting that need is going to impact other people as well. So it just depends on what we're discussing, but you definitely have to have an open dialogue and open communication. And I think one way to make open dialogue and communication better received from the listener or who you're trying to communicate to is offering suggestions. So it's not coming across like you're just complaining about something, but it's that, hey, I have a concern and here are some of my ideas that maybe you are be willing to consider.
And
I
what you
also
said,
think,
Dr.
like, I
Jackson.
found it easier to just ask her what you need. So instead of saying to, my principal or leadership, there's too many kids and this is not, can I get 2 more desks? Yes. So we might not be able to get the bathroom cleaned immediately, but I can get a spray bottle upstairs. I can do that. Like, generally just asking specifically for what you need is
Yeah.
easier, because it does come down to a lot of times what we need is actually a simpler thing than the bigger problem. Like,
Yeah,
at this
right?
moment, I need blank, and 50 people come in with like, here's blank.
Right? Remember what I said earlier, up under every concern is a need, right? Up under every concern, there's a need not being met. So to speak to that, to communicate that and express that, that's how the communication becomes much more effective than just simply communicating a complaint, right? Or an issue.
Some of the things you said, Dr. Jackson, kind of tie into this next comment that we have, because not only are we dealing with COVID, educators and everyone in society, we're dealing with the government, we're dealing with race relations still. So everything is compacted, causing extreme stress. One comment that we have is, I found that school resistance to racially just work. How can parents leverage their voices to get things done inside the school for this priority? So this is kind of segueing into race relations in the school and trying to get voices heard.
You used a phrase, and you used a race.
It says,
does she mean justice? I'm wondering if it's a typo. I wonder if it's justice.
I have found schools' resistance to racial, probably justice.
Yeah, it's probably social justice. Yeah.
How can parents leverage their voices to get things done inside the schools for this priority?
So I think it really goes back to, when you talk about leveraging your voice, being consistent is always key, right? So when we look at how do people who may be considered, I don't really like the phrase minority, but for the lack of a better phrase, how do you get a small group of people, right, within any population or subgroup, how do you get a small group of people to have their voices heard and actually attended to or responded to in a positive way? So one is being consistent, right? So you can't just say it one time, right? You have to be consistent with what you're saying. I think it's also important to write out what you're asking for. So again, you're not just complaining and saying, this is terrible, this is horrible, this shouldn't happen. Why is this happening, right? You're being extremely specific about what you're looking for the school to assist in accomplishing within the school, right? What you want to see, yes, what you want to see different, yes.
And I apologize. One of the things also I would suggest for this parent would also be to attend school board meetings. And they do have, I know our district and other districts do have academic committees that reflect or that are part of the school board meetings. That sounds more also sounds like something that you can suggest things to be integrated within the curriculum. So, I know for a fact that Detroit Public Schools Community District, Novi, all of the school districts have academic committees. So it could be, sort of finding out when they have that academic committee, and during the open comment portion, be able to have conversation with the school board, committee that deals with that, to be able to integrate some social justice components within the curriculum. A majority of the curriculums that are coming out currently actually do have those social justice seeds embedded within them. But if it's an older curriculum, I would definitely suggest that. There's so many things on the internet now that have to do with social justice and integrating social justice into social studies classes and all of the classes. So I would definitely suggest that way, as well as going back to what we just talked about, open communication, having that communication with the principal. And that is not going to be something that's going to instantly happen. because curriculum is a process. It's a process to be able to get that going. Teachers do unit plans and lesson plans for weeks and months ahead of time. So you may have a great social justice lesson. That doesn't mean it's going to be implemented tomorrow. Doesn't mean it's going to be implemented next week. But I would suggest participating in the school improvement team. So the new or instructional leadership team. But sitting in on the school improvement team allows you as a parent to have that voice and be able to once again be able to sit at the table with the decision makers, because you are a part of that process. You do have a voice and be able to interject integrating those types of lessons in the curriculum.
So involvement, in addition to the communication, is so integral in the question and making progress, or getting to the point of accomplishing what the question that was just brought to our attention. Being involved, and again, I can't emphasize enough patience, but involvement, and I think I've mentioned this before in a different, maybe one of our other series, is that involvement can help to alleviate the feeling that things are just happening, right? That things are just happening and I have absolutely zero control over any of it, right? There are things in life that definitely happen that are outside of our control. However, there are other things in life that we can participate in and contribute to and have some voice in. And so being able to engage and participate, I know sometimes has been communicated on several different platforms that the school systems are truly looking for parents to be more involved and more engaged in the educational, not just their child's education and their educational journey, but the educational system as a whole. They need parents. Parents give extremely valuable insight as to what is needed because just of your role of being a parent and having a student, having a child going through the educational system, whatever system or district that is. Selena, I know you were.
One more thing that I would, when I talk to parents and they come into the emergency room because their teacher sent the child there or for whatever reason, and when I'm talking to the family, the other thing that I remind them is how you present yourself when you are bringing these tough conversations up with your teachers or your principal or the counselor or whatever, is that you need to remember that it's very difficult because you're emotional because this is your child, but you need to take the emotional piece out of it. And you also need to take out the I's and the U's, I, or you, but, talk about it in a general term, because if you have this problem, there might be another student out there that has the exact same thing, and maybe their parents don't know how to voice it. So, you have to make sure that your behavior is appropriate so that you come across as like, this is a concern, and it could be concern for others, but, also talk to the other parents. You probably have other parents that feel the exact same way. And so when you go to the school board or you go to work on it, it is easier to go as a unified group than a whisper in a crowd, because when you go by yourself, sometimes you're a whisper in a crowd, and so, take a look at your environment and look at the other families around you. You probably have other families, but when you come in there, discuss it in a general term, and you'll get a lot more people listening to you about it.
Good answer, Selena. One of the comments as well is communication is key. It says, please Gail offer workshops on how to communicate. Most people don't know how to advocate for themselves. And that is the answer as well on a lot. Taking that emotion out, personal emotion, is probably tough, especially one, if you have a child who's being affected by what you're trying to advocate for. And two, if you continue to advocate for something and you see no results. I know, Mr. Perry, you mentioned things don't change overnight. And then Dr. Crystal, I thought about the patience that you told me to have that I'm still working on. Sometimes you wait and wait and wait and wait, and then the anger starts to elevate and elevate. And I still haven't figured out how to bring that back down when you don't see the changes that you expect in a reasonable timeline. Who defines what's reasonable?
Well, can I say this, Gail? So I'm just going to toss this out here, Gail. First,
Thank you.
just okay. So you pray,
Mhm.
you calm yourself down, you
Right.
meditate, whatever your vice is, right?
Mhm.
So you do what you need to do to have a woosah moment, and you calm yourself down, and you try. So when we use the phrase or this, take the emotion out of it, some people don't know what that means. It's really good advice, but I think sometimes people need to understand what does that mean? What does that look like? If I take my emotion out of it, what does that now look like? So what it looks like is you sticking to the facts. That's how you take your emotion out of it. So it doesn't mean that you are now emotionless and you have no feeling about what is happening. You're still bothered or irritated by what's happening, or you're not pleased with it. But you take your emotion out of your communication when you state the facts. So that's the best piece of advice that I can offer the listeners when they're trying to figure out how to take the emotional aspect out of it. Because when you stick to the facts, you can't. Well, I'm smiling.
Facts.
I was going to say you can't debate the facts, right? But I think we do that oftentimes in politics. But I thought about the political realm. But aside from that,
there's really no emotion in facts.
Well, exactly. Emotions are very
they're just numbers, or they're just data points. And so there's not good things or bad things that go with it, because it's the truth.
Yes.
And so
absolutely.
when you speak that, you don't get really upset unless you go in there, well, I need this for my child, because then that's when that emotion comes back with it, when you're kind of bringing in all that personal piece to the fact.
Yeah. And I think sometimes it also helps for us to plan out what we want to say before we say it. Now, yes, sometimes you're in a meeting and something is said, and then you respond to it, just kind of comes out before you even think about it. But I think there are times where you do not have to respond right away. There are times where you do not have to respond right away, especially in a work setting. So we're talking about teachers or medical professionals, and there's a concern that they would like to express. Well, unless you are resigning, right, the next day, and even then, if you're resigning, you can say whatever you want to say after you leave. But if you have something that is a concern and you want to express it, you do not have to express it in that moment. You can take a step back, think about exactly what your concerns are, what you want to express, and then that too can be another technique or strategy of taking the emotions out of it, because now you're not responding in the midst of a situation. You're not reacting. Now you're actually able to respond appropriately.
And I agree, Dr. Crystal, with the stepping back and then giving it thought, giving it prayer. I heard you mention that. Whatever your strategies are for checking out what's real, what's fact, what you want to say, and your intentions. But with that, I also believe don't hold it, because then when you internalize your feeling and your thought, be it right or wrong, that can cause added stress. And I think when you're dealing with other adults, be it management, and I don't know, be it management, boss, coworker, whatever, you should be able to express yourself and not hold it, as long as you're respectful and engaged. Because when you hold it forever, I mean, what does that do? It makes you more enraged. It makes your personality may not even be what it really is on the inside. But I think so many people hold even their feelings with what's going on with COVID, your stresses that you're having now, and the pressures that you're dealing with now. Share it. Don't feel like you have to hold it in and internalize it, because it causes health problems, it causes mental problems, it causes things to elevate that may not have even gone that direction if you just release. That's my opinion on that.
Right, exactly. You don't want to implode.
Mhm.
right? In essence, is what you're saying, Gail. You don't want to implode, so you don't want to hold. You don't want to hold in so much where when it starts to, you can only brush so much mess under the rug, right? Before the rug starts to elevate, right? Because you've been brushing things up underneath. And then as you are trying to maneuver through life, now you start tripping over the mess that you have been shoving and stuffing, right? And then over time, it's going to eventually seep out. And so when things start to seep out, that's when you lose control, right? You follow me? So if we can literally visualize a rug in a room and we are constantly shoving things up under that rug, eventually it's going to get tall enough to where if we try to walk over that, we're going to trip and stumble and fall, which is going to make things more difficult for us. It's going to create injury. And then as we continue again to shove and sweep things under the rug, things will start to seep out. And if it does that on its own, we lose control. So things are seeping out from the left, from the right, from the back, from the front side, right? You lose control of the situation. And so that's what you don't want to do. You don't want to lose control. And that's how you that's how you take your emotions out of it as well. And another strategy, by not holding things in, because when you hold things in, then it's like, we've all heard the phrase, the straw that broke the camel's back. Right. And typically that happens when there's been a lot of things that's been happening, been piling on slowly, consistently, and then we're not addressing it. And then that last straw, it can be something incredibly minor, but because we've been holding on to so much, we blow up, right? We implode, and sometimes we explode. Right. So sometimes we cause damage to ourselves, and then other times we cause damage to other people, or both, which is not what we want. And if people are feeling that way, I think it's important that they understand that maybe a good sign that maybe it is beneficial to participate in an EAP program, right? I mean, EPA program, right? I said it right. EAP, Employee Assistance Program. So maybe that becomes a sign, right? That's needed, or you can do that on your own if your particular employer doesn't offer that service, but you know that may be a sign when you are starting to either become a danger to yourself or someone else because of your emotions, even if we're not talking about physically harming others, but just emotionally harming either yourself or someone else. That would be a sign and symptom that maybe mental health services may be of benefit, for you. I think that with what we're talking about tonight, I don't want this to end without us being maybe extremely clear about what, Selena, you mentioned it earlier about bringing the care into the employment setting.
Yes.
Into the work setting, which is extremely helpful when people are feeling as if time is limited. And then Damien, I know that you mentioned Leah. I can't remember if both of you shared the same experience of bringing things into even the school setting for students. I know for sure. What about for the teachers? What's being brought to them to make things easier?
I'm sorry, can you clarify, like what are people doing to make it easier for us now?
Yes, that's going to assist with their adjustment to the pandemic and managing mental health care.
Sure. So our school has been very transparent about access to mental health care. We have a number that we can call, and they make it very easy so that we can get the help that we need there. But I think on top of that, just in the day-to-day things, and again, going back to the idea of grace and empathy, as I know, that teachers are constantly, we're under a lot of stress. If people explode, and our leadership is, does not judge anyone for their tone, so to say, and the way things come out sometimes. I know, my husband's a high school principal, and right now he's covering 6 classes so that teachers who have health issues can be remote. we can never get what we need, but I do, because I think it's an impossible situation. I've been very pleased by seeing what actually has been provided, and whether that be, you know, we have our leadership covering our recess duty if we need to do something. The other day, somebody was out, and the person who's in charge, our HR person, was upstairs covering lunch. You know, everyone is, I do believe, doing the best that they can. You know, until we're out of this pandemic, I don't know really what else can be done. I think everyone at the moment that I know of is doing what they can do to the best of their ability in that moment. I can't ask for anything else. I think for me, the biggest thing is just knowing that you're not in it alone, that there's that open door policy, that I know that I can say whatever I need to my supervisor, right? And that, you know, I can wake up and have a job the next morning, that people are patient. And so beyond that, I don't know. And when you're at home, like, so when you're remote, I don't know what more can be done, because it's very little, it's very difficult. So as a teacher, like, for instance, I'm home, my husband is a principal, he's remote. My 2 kids are in college, but they've been back from college for 9 months working remote. So I don't know what the school district can do, right? I've got 2 kids who are all day long in on their lectures. My husband is trying to get in on his school. You know, the broadband in Novi, even though we are this technological center, is not the greatest in the world. I won't mention names of providers, but I live in Village Oaks, and apparently it's the Bermuda Triangle of getting really good Wi-Fi. School can't do, you know, the school's given me, you know, a computer to use, and, you know, any kind of technology that I need. At the end of the day, like, what, you know, there's nothing else that they can do. I really feel like what we just need is to get healthy, get past this, and I don't know really what more.
I think you really do. I'm not playing counselor or anything. I think there has to be a time where you find time to smile, because things are just, you know, I don't know if they're getting better or worse, or what. At times it seems like, okay, we're coping a little bit better, then boom, we're hit with yesterday's occurrence, or boom, we're hit with something else. You know, we have to find time to find out how we're going to process what we're going through. And I'm hoping before we leave, as you mentioned, Dr. Jackson, people do walk away with something, because there are so many people who are struggling. There's so many people who are worried about their jobs, frontline workers worrying about life, worrying about if they're going to even have a job the next day because of this, that, or the other, worrying about if I express my true feelings, what will be the ramifications of what I say or what I do. You know, I can't cry at home in front of my kids and my spouse. I can't, you know, things can reach such a plateau that, you know, you don't know what to do. And I think there has to be a time that either you reach out to a professional, you reach out to a friend, you reach out to a family member, or you step aside yourself in your own private space and let it out, and then find some joy, whatever it is, even if it's just for a moment of time, because the brain can only take so much. And it's really important that you can't feel alone, or you can't feel like I can't be the one to let my guard down, be it a principal, Mr. Perry, be it the head of Ascension's behavioral, whatever, Selena, you know, whatever, you know, even the psychologist. You can't feel like your position is so high or so low that you can't express yourself or relate to anyone, because being able to relate to someone is sometimes a challenge. You think, you know, you can just talk to someone in your home, and maybe you can't. Maybe you feel like you can't. So don't feel like it's a hopeless situation in addressing the feelings that you have.
I also think it doesn't really hit on joy, but and I'm sure Mr. Perry has seen this too. There have been a lot of positives. Now, I would never have gone through COVID to have this, but there are kids who, you know, because normally when we're there and we help them, we might be pulling too much. So suddenly kids had to struggle a little bit. That was good, right? Mom and dad couldn't help them right away because they were dealing with their own jobs. That was good. I think in general, we have as a society really helicopter parented a lot. And even as teachers, we probably help, you know, kid says, I don't understand the directions. I'm immediately there explaining it. Well, I can't, because I'm, you know, I'm now have all these people and I'm online, I'm trying to do it. So not that you don't want children to struggle, but you want them the same way. Like if you're weightlifting, if your trainer is always pulling on the bar, you're never going to get stronger. So they had to get some resiliency, right? And in a little bit of perspective, and maybe things that they hadn't before. Also, I noticed just in terms of behavior, like now that we are back in school, kids are so grateful to be there. Right? They're so grateful. Like our behavior issues are down to this. Just things before that were such a huge issue, they'll say, their reflections will say, kids will say, and this to me is like one of the, I guess the moments of joy is, I never thought I'd say this, but I am so grateful that I am in school. I never realized what I didn't have. We have, kids too, now for us, I'm Jewish, I teach at a Jewish school. We had Passover over Zoom, and kids were now all of a sudden they were connected, even though yes, we didn't have all our family like we normally do at the table, they're Zooming with people all over the country and all over the world. There are different positives that have come out of it. And I even think in terms of teaching, no one can get through the curriculum, right? Because we have all these things. But then the question is, are we supposed to be getting through all the curriculum, which makes teachers and leaders and administrators look at what are we actually teaching? Why are we teaching it? Does this need to be here? Does this have to go? And I think just in good pedagogy at any time is really questioning what are we doing? And there are things we've probably been doing because we always did it. And all of a sudden we can't. And then you look at it and you say, maybe that's actually better not to do that. I know for me, I'm thinking to myself, if next year or the year after that goes back to normal, I might not go back and add those 2 additional units. I might just go deeper into what we have because I notice the kids are getting more out of it. So I think another thing is just to look at, there are a lot of positives that have come, ironically out of this horrible situation.
Leah, I
To
think what you
also
said is spot
remember-
on. I think that, when Gail talked about, people taking things away from this segment that we're having tonight, that would be one of them, would be to, what I call positive journaling. And I may have mentioned this before as well in another segment, but it's positive journaling. So it's not just journaling your emotions and your feelings, of negativity or, things like that. It's really being intentional. It's
Sure.
being intentional with focusing on that which is positive in the midst of something like what we're going through, a pandemic. And even if we weren't going through a pandemic, that's something that I talk about a lot in my therapy sessions with those who I'm working with, is positive journaling. So if I'm working with a person and their default way of thinking seems to be very negative, and that's what they're coming in for, then I go right into, let's focus on the positive. Let's get a journal, any notebook that you have around the house, sheet of paper, whatever you have. You don't have to go out and buy anything special, but it's just something to keep track. Because what happens is that we, in essence, what I say to people is that we have to retrain our brain, right? So especially when we're going through a lot of stress, the negativity can just come out so easily, right? It's like automatic. Right? There's always an issue. There's always a complaint. There's always something going on that's wrong, that's hurtful, that's sad. We're grieving. There's a loss, right? So all those things, we don't have to work very hard to see the problems that we are faced with or the challenges that we are faced with. What we do have to work on is being very intentional and purposeful in our attention to the positive, so that we don't slip into this cognitive distortion of filtering out the positive, and we believe that all things are bad, or all things are horrible, all is wrong right now. So in order to help us stay out of that slippery slope, it's very helpful at times to think about those things that are positive. And sometimes people are not, and when I say think about things that are positive, I mean anything. I mean the fact that the sun came out today, all the way to you actually doing something that you're proud of and feel good about, or something that would, happen at school, or something that happened in the hospital today, right? I think, Selena, you mentioned sometimes it's worthy of saying, we had these many deaths this day or this month or at this point in time, and now we're down to this. Those things matter. They matter so much because it's so easy to slip down that slippery slope of negativity when we're going through a lot in all of our lives, right? And it's always on social media, it's always on the news, the local channels, right? So I think that's something that is so incredibly important, is positive thinking. And one way to assist people with positive thinking is positive journaling. So keeping track of all things that are positive, because those things, again, are factual, going back to that statement that I made earlier, are factual, and we get outside of our emotions, because emotions are temporary and sometimes they feel like they're really permanent, right? So we feel like things won't ever change. It's going to always be this way, right? And really it's not. Really things are ever evolving, things are ever changing. And so in order, again, to not go down that slippery slope, it's important that we recognize that things are always changing. And if you keep, I give this example sometimes, when you are not feeling well, you're sneezing, you're coughing, right? There's something going on pre-COVID, okay? So things are going on and you realize that you need, I don't know, cough syrup, right? Or medication to get rid of the fever. It is so much easier to simply go to the medicine cabinet within your home, get what you need, treat yourself, and you never have to leave your home. Unlike not feeling well, not having what you need in the home, having to drag yourself out of bed, warm up your car, drive to the store, try to find a place that's open. It's much more difficult and it's much more draining, and it creates more strain and stress. That's the concept of the positive journaling. You keep track of those things that are positive. So when you are having those moments of distress, you have something readily available that you can go to and open up and remind yourself in that moment. Because sometimes when you're starting to slip down that slippery slope, and your mind starts to play tricks on you and causes you to think in terms of absolutes, like this is always this way, this will never change, this is all right. So those absolute statements, I say your mind is playing trick on you because those statements are not true, right? But in the moment, you believe that they are true. So before that begins to happen, if you have something readily available to remind yourself that you can just open up, because sometimes when you're already in that state, it's hard to think it's hard to think positively at times, right? But if you have something already available that you've been keeping track of, no thinking involved, you open it up and you read it. You instantly remind yourself of those things that are positive, those things that are good in the world, even in the midst of the bad stuff that's happening, right?
Very good.
Yeah.
Mr. Perry, is this hand raised from earlier or is that now?
A little bit of both. One of the things we think Leah did a great job of talking about what are some of the joys that have come, and I use that word very sparingly when we talk about COVID. But one of the things I can say that has come about from it, specifically in our district, has really been in Mumford, has really been transitioning to being able to provide parents options when it comes to meetings and sessions. So we've been doing our parent-teacher conferences for the first time was online. So literally for a school the size of Mumford, we had over 280 parents participate. Now I know in a school of 1,000 students that may seem like a low number, but I can tell you, in being an administrator and teaching in urban schools, to have 200 plus of your parents actually come and participate in parent-teacher conferences. We do the same thing with our parent-teacher association meetings that happen. So we've transitioned to having those meetings online, and it's amazing how many parents actually sign in and just listen to the audio and participate. So there have been some components, I think, that have allowed schools to evolve and really be able to provide a higher quality of education, as well as provide the flexibility for parents to participate. I think the downside is going to be that I don't think that there'll ever be a thing called snow days. Because now I know specifically within our district, and I'm sure districts across the state, now that the technology has been given, mobile hotspots and that kind of thing has been given, there's no need to have a snow day, because quite honestly, if the school—
Come on, Principal Perry. Okay, like a true principal, right?
Now it just automatically transitions to, okay, that's perfectly fine. There may be, a foot of snow outside. Everyone do remote learning. So it's been some very, very interesting growth that has come out of this pandemic.
Mhm.
Mr. Perry, I wonder too if you ask your teachers. I found that we did conferences online too, is that parents were so much more comfortable in their own homes. And I think that when a parent walks into school, it triggers a lot of their own, for so much, I know myself, like my fear and anxiety for my kids always is stemming from myself. It's about me, right? It's not about them. So if your experience in school was not that great, or you struggled, or, you were anxious, whatever it was, is that walking through the doors triggers that for so many people. And they come in, and when they sit in front of you, they're coming, from a place of just feeling, anxious, and it's all pent up. And I found that online in their own homes, or people were already comfortable and in control of their environment, and not that stress of waiting in line the way they would normally wait in line, at least for ours, they went so much better. Like people I thought were so, just receptive and open, and just really just felt more comfortable to me. I thought, when we can come in person, I wonder if we should keep doing this.
I agree. So we had talked about in our ILT instructional leadership team, as well as our conversation with parents, we will forever give that option for parent-teacher conferences. So through the little online scheduler, to be able to sort of have parents be able to choose the option to be able to actually do it online. And with Microsoft Teams, you can do either on the computer, or you can also do on the phone. So we'll, give parents that option, but that'll definitely be something that is forever part of any school that I lead, being able to provide parents with that option and families that option.
I think we've had a good therapy session. I've enjoyed this. I see your hand is up, Selena. We're going to give you a couple of more minutes, and then we're going to close it out with you, Dr. Jackson. When we
I do want to say, though, for those that are feeling anxious or not sleeping well, whether they can't fall asleep, or they're waking up in the middle of the night, or they just feel, they got a weight on their shoulder, there's a lot of resources out in the community now. Almost everything is virtual. So you can see counselors virtual if you needed something and you had sit or transportation issue. But there's also a lot of apps that have come out. There's apps called My Strength, where you can go in. We have the WISA app that just launched. And you can actually go in and program it to you. What are your symptoms? So mine might be anxiety. I can't fall asleep at night. And they actually give you some tools, that you can start doing in your home at night to help you. There's also the button for the SOS that will take you, right into a 911 call if you need it. There's a lot of, the state's coming out with a crisis line that will be directed right to your local community mental health agency. So, don't suffer alone. There is a lot of resources out there. There's a lot of ways to get help nowadays that there wasn't there prior to the pandemic. But one of the things that we really did with our associates is that, and Dr. Jackson already spoke about this, is that you have to really look at the positive side to something. Every negative has a positive. You may not really understand it, you may not realize it, but there is something good there. We work with all of our substance use disorder people and to help them to identify that. What we have created are some rock gardens, and they've actually been able to put triggers or the happiness or the people that they've lost. And we have created these beautiful rock gardens at some of our hospitals. We have hand painted words on it from our associates. And every day it's a remembrance of either where they've been, where they've gone, how lost they may have felt, or those happy moments. So, whatever that is for you yourself, you need to find those little pieces that remind you on a daily basis your self-worth and how good you're doing and how resilient you are, because you're going to bed at night and you're getting up every single morning and you're doing it again.
Selena, what were those apps you mentioned again?
One of them is called My Strength.
My Strength. Okay.
And you can program it. The other one is called WISA. We've been, actually starting to use it a lot with our patients and our associates.
Mm-hmm. Thank you very much. Well, I appreciate our conversation on this. I hope people walked away with something beneficial. We are going to have another program. It will be January 14th. And this one is Man Stress. You're Not Alone. And I'm really looking forward to that one, because I don't know, you can say whether I'm right or wrong, but it seems like men handle stress differently than women. A lot of times it's internalized and never released, or it's released in a totally different way than many women or children or something. They just have their own area that I think they should have their own special day of us tending to their concerns. So whether they are attending, or if a woman who has a husband or a son or a brother or an uncle, just want to learn more about how you deal with man stress, I encourage you to attend or sign up for the program for January 14th, once again at 6:30 p.m. And Dr. Jackson will be our special series guest again, but we'll also have a social worker attend with us as well. Dr. Jackson, I'm going to turn it over to you. You can maybe say a word or two about that and close out however you wish.
Well, the social worker who we're going to have join us next week is Mr. Joe Lilly. And he is the owner and also therapist at Lilly Brook Counseling Services. And they're located in Troy, Michigan. And he will be making himself available. And we are thankful that we have the opportunity to work with him. He has been responsible. He's been in the field now for, I would say, close to 15 years, but he has had several very helpful support groups for men. And I think that he is definitely going to bring some of his expertise and knowledge and insight as to treatment and interventions and just the unique emotional expressions that come from men, and how men may be able to deal with that, and how they can feel better supported as well. So I'm looking forward to our next series.
Appreciate it. Well, thank you, everyone. Thank you so much for your time, Dr. Jackson, and all the rest of our panelists. Thank you for sharing whatever you had to encourage, inspire, inform, include. Have a good evening, everyone. I hope you can join us again, and keep the faith. I always say each time, we're going to get through this. It's going to get better. Even if it gets worse before it gets better, it's going to get better. It's got to, right? We all have to believe that. So have a good night, everyone, and thank you for joining us.
Thank
Thank
you.
you.
Thank you.